today. I really am very privileged to invite Sangeeta Chandran from TCS. TCS is one of our stellar healthy workplaces, and she is the global head of TCS Cares, their mental health and well-being program. She's also a certified integrated therapy counselor and the founder of Dandelion Stock. Besides this, there are many things that she does. She's a student pilot, a car rally enthusiast, a blogger, and her favorite pastime, or one of the things that she loves to do, is to walk her dogs, do yoga and meditation to keep fit and agile. Before I hand over to Sangeeta, I'm sure she'll be able to, I'm sure she'll be able to share her insights and achievements of keeping people safe, secure, and motivated during this entire COVID-19 phase. It is a finite phase and it will be over. We have an interesting topic. So the topic is around keeping the mind healthy. Mental well-being is one of the most important things, and healthy mind in the VUCA world is the topic that we are going to discuss, and it's going to be an interactive session. So the overall session will be for about 40 minutes. 20 minutes will be, the discussion with Sangeeta, and then followed by question and answers. We really want this to be a very interactive session, and we urge all of you to share your thoughts and participate in this session. So over to Sangeeta. Sangeeta?
And it's my absolute joy and privilege to do this session with so many colleagues. And as you were saying, the mix of people are all the people who are associated with Arogya, and as you know, we are also quite happy and really find that the work we did with Arogya is useful to us. So I'm sure that's the same with everybody. And so probably we have a lot of like-minded people here on the call. Guys, just a very quick confession. I'm used to using WebEx for all my meetings, and this is, one of the few Zoom calls that I'm using. So bear with me in case I look as if I'm a bit technically challenged. I'm just going to share my screen and use a PPT to walk you through some of the stuff that I want to talk to you about. Ashwini, I think you might need to enable my sharing. It says it is disabled.
Ma'am, could you try again?
Now it's there. Great. So can you guys see my screen?
Yes.
Yes.
Wonderful. Wonderful. And I want to see more of you, so I'm putting it in tile view here. Okay, great. So, Ashwini and I were talking, and she said, can you share what it means to have a healthy mind in the VUCA world? And I said, while we use this word VUCA, in the context of everything that happens when there is a upheaval, and she's just right, this is absolutely a VUCA time, which means that it is volatile, it is uncertain, it is complex, it is it's ambiguous. And, this term has been used time and again for various kinds of things that have happened across the world. It was coined in the late 80s and, was used a lot by the US Army to describe any situations that they got into when, they were getting into some sort of a foreign land or any of that. But it really does seem that actually really is the VUCA world now. And this pandemic that we are going through, the COVID-19 pandemic, is probably the biggest VUCA phenomenon that we have ever seen in our lifetimes. And probably there will be stories that even our children will tell about how they lived in the time of COVID. So when we have all this happening to us, what are we dealing with? And so of course we are dealing with a hugely uncertain and unknown epidemic, and the COVID virus is a virus which is still not fully understood. Even the doctors who talk about infection and the people who are experts in that field are still trying to figure out exactly the modalities of how this virus operates. They do understand it quite well, and they do tell us about how it spreads and proliferates really fast, the kind of surfaces that it lasts on, what kind of precautions we need to take, and all those things. But in addition to that, if you see what the WHO says, that what we are fighting right now is an epidemic, and we are also fighting an infodemic. And this is what differentiates the COVID-19 pandemic from anything that has ever happened to the world in the past. Because what's happening right now is the kind of things that are happening simply because of the way information is spreading and the way we are consuming information, and that really makes this more of not just a corona contagion, but it also makes it a social contagion. So social contagion, of course, it means that there's a spread of emotions from one person to another. And right now, the way fear is spreading, the way panic is spreading, the way anxiety is spreading, it is spreading way faster than the coronavirus itself. So if that is the case, then maybe it's a good idea to understand why this happens to us, because when we are empowered with understanding and knowledge, the likelihood that we will take better decisions is much higher. So let's try to understand why we behave and why is fear and anxiety so high. If you were to look at, if you were to look at this time, fear is something which is absolutely the most prevalent, and fear is the emotion that is hardwired in our brains. So it is a part of our evolutionary process. It was part of our, fight or flight. It was what saved us from danger. It is what helped us to survive. And in the current situation, that is exactly what our minds are telling us. In fact, if you were to look at our brain, the part of the brain which is actually telling us this is the most primitive part of our brain, which is of course the limbic brain. So the limbic brain, which resides, right at the back in a really small corner, really becomes active whenever there is a sense of danger, and tends to take over our front caudal brain, which is our more evolved brain, which is a more sophisticated brain, the brain which allows us higher level of thinking, logic, analysis, and all these things somehow just go flying out of the window the minute fear and panic strikes us. And I think we are seeing that, right? In all our behaviors, we're seeing that. So for example, we all know that even though the fatalities are definitely going up, but we still know that, fatality is due to things like road accidents or heart attacks or even cancer are probably much more than what are happening due to COVID. But, these are known threats, and our minds have been able to develop a certain kind of
कुछ ना कुछ लग रहा है ना उधर तक
certain kind of a defense mechanism to deal with them. But because
stay
COVID-19
कर
is
रहा है ना बस
an
से बस
unknown threat, we still don't know what the consequences are, and we
he's
feel it
afraid
is insidious. I think there are some calls which are, thank you very much for muting. This is what is causing all the panic. And when we start to panic because of the thought that our basic survival is in question, this is called survival panic. And when survival panic happens, it leads us to all sorts of extreme behaviors. Like, for example, panic buying of food or masks or hand sanitizers. Or it could be, feelings of xenophobia or anger against people who may be, back from travel, or those who may have a cold or cough, or those we think are hiding. We feel these people are, not being responsible. We feel people are actually responsible for becoming threats to us, and then we feel like alienating and stigmatizing them. And all these behaviors come from this the sphere of fear. So when we deal with any sort of adverse situation, there could be, either two types of things that happen to us. We are either, people who take risks. So, the people who are still out roaming around in groups, or, we can see them seemingly unconcerned and putting other people's possible, health at risk. These are risk takers, and they are not only a danger to themselves, but they are a danger to other people. On the other hand, there are people who are very, very risk averse. And these are people who, of course, go into the survival panic mode and, go on to things like panic buying. So if a risk averse person is panicked and is buying up all the hand sanitizers to keep themselves safe, they seem to forget that there are other people who could actually spread the infection and they may need the sanitizers too. So both these ends of the behavior are actually not useful to us. And what we really need is to be able to be risk conscious and operate from a more stable sort of a perspective around that. So if that is so, then how do we cope? How do we cope with this risk or anxiety or panic that we are going through? And there are many mechanisms. I'm sure all of you are aware, but run through a few of them with you. Firstly, of course, we need to take care of all the basic medical sanitization precautions which the doctors are telling us about: washing our hands or wearing our masks if we have a cold. These basic things, social distancing, we need to do all these things. Secondly, we need to be mindful that uh, we are we are not we remember that we are in a area of hyper awareness and stress, and due to this constant uh, communication via various channels, and we need to be really mindful of that. Now, what are these channels and what do we do with them, right? So we, of course, we need to keep ourselves updated. We need to know what is happening. But at the same time, we also need to make sure we're getting our information from the right sources, from reliable sources, and that, there is no unnecessary panic because of something that we may spread some rumor, we may listen to some rumor, and that causes a lot of panic. So if you find that stress is really high, the first thing we need to reduce is our consumption of the information that we are actually using. So whether it is usage of mediums like WhatsApp or Facebook, or it is news channels, be very careful about what you allow yourself to watch. If need be, take yourself off some of these groups where there's too much of all this sharing. And if you must talk about things, maybe talk about the positives of these things, or share some light-hearted or share some introspective messaging, which I think all of us are doing more and more as we talk. There are new terms also which are coined, and we started off saying social distancing, but a better term to describe the state that we are in this lockdown is probably physical distancing. And while physical distancing is on, that doesn't mean that we need to be emotionally distanced from each other or socially distanced from each other. So I think, we might have, in the first few days, we might have been talking to each other one-on-one on calls. And now I think you can see across all sorts of social media that people are having so much of fun doing group calls, group events via things like Zoom or Skype or FaceTime or any of these mechanisms. And that is really a wonderful thing, because that is the really good use of technology that we are beginning to. We can also view this time of physical or social distancing as a contribution to society, because it means that we are doing the right thing, the noble thing, and making sure that other people are not getting infected. We could also do other things, like we can check on the old people in our buildings. We can ask them if they need anything. We could serve them a meal once in a while, ask after them, because these are people who could be quite alone, and sometimes get forgotten because they don't say much. Another thing which is really required is maintaining a routine. So we've all gone through this phase of this lockdown and this thing, right? I mean, first few days we probably all slept in late and sort of believed like we were a bit on holiday, but that is slowly changing, and we realize more and more that unless we maintain a normal routine, because this is pretty much the new normal, and unless we maintain the new normal routine, our lives and our health completely goes out of whack. So binging on Netflix and chill, okay, once in a while, but it really is not the norm that we can follow on a daily basis. practices. So maintaining a routine helps us to stay healthy. It also provides us with a sense of control over our environment. And that actually, from a mental health perspective, that is a really big one. The other thing we need to do, of course, is to exercise. So, exercise releases endorphins, which are our happy hormone. And so if we do about 30 minutes of physical activity a day, it boosts our mood, it improves our sleep, it boosts overall immunity. So this is definitely something which we all should do, and make sure that we follow a good routine in this as well. Eating well, avoiding snacks and binging all the time, being careful about how much of alcohol or smoking that we are allowing us to do. These are very these are the kind of times that people who are people who probably quit smoking have probably started smoking again. The people who have a once in a while drink will probably say, oh, come on, I want to drink every evening and do that. So these are all things which we are all experiencing, and the point is that we need to be watchful of that. We also can do other things. So, this is also a great time. I don't know how many of you, but any of your friends who are, part of various organizations that meditate and do things like that, you'll find that there are people who now, come out and really talk about this and say that there is nothing better than mindfulness and meditation to help you in times of stress. And, if you haven't started doing that, it's a great time to start. And it doesn't have to be a very difficult one. You can download a app like Headspace or Calm, and these are really very nice ways of starting to meditate. So this is another thing which is highly recommended from a perspective of keeping a healthy mind. Also try to anticipate that distress is going to happen, because if we know that this is a time of distress, we know that it is okay to be vulnerable. We know that it is okay to be going through a trauma, going through problems, and it is okay to be not okay during this time. So those are some of the things which we definitely need to keep in mind when we are dealing with coping with stress and panic and anxiety. Everyone can see my slides? I just want to, yes? Okay, great. Thank you. Okay, so then let's talk further about this, WFH, which is beginning to sound like a bad word these days, if you ask me. So, and so work from home, or the new normal, as a lot of people are now calling it, is becoming the reality of our lives. And what do we do in this new normal? And especially from a work and productivity perspective, this is a huge one. And all organizations are now doing so many different things to try and see how they can make sure that this is optimized, and that people don't somehow feel lost and feel how are they going to handle this. So there's so many different things to do when we put this in place. The first thing I think is to make sure that we have we understand that this new normal is not our old normal, and so therefore the way we functioned in the old normal will not work. So first things first, how much do we understand each other? How willing are we to be okay with a child crying in the background when calls are going on? How do we make people feel at ease when that happens? Do we know how much connectivity people have? Because Wi-Fi, especially in our own country, is not exactly the best, and there'll be always times when people complain that the Wi-Fi is too slow, it is crashed, and they're not able to work. So do we believe them? Do we look at them with suspicion? What about people who don't have enough space? They share apartments or share rooms, and how will they work? Will they have the privacy to do that? So some of these things, and in fact, working from home with the new normal is actually a entirely, another webinar altogether, in fact. And when we do that, the biggest thing around that is to have empathetic leadership. And, organizations are now, doing a lot of things to talk to leadership, talk to them about what should they do, because leaders are people just like anybody else, and they are also in this new normal, so they don't know how to cope. And, so what are the basic things that they should do? Do they have a call with the team? What do they say on the call? What do they share with each other? How do they make working remotely fun? How available are they there to the teams, so that the teams, when when they are sitting in a physical environment and you need something, There are times that you can just walk over to your team leader and talk to him and figure out how to solve something. Now that person is no longer there sitting next to you. So how do you make yourself available? What are the things that you do to make sure people understand that what is the work that they're supposed to do? How do you track productivity without becoming seeming like the big brothers watching? So these are all things which are part of empathetic leadership, and these are programs which every organization, if they are not doing it, must start doing with immediate effect, because this is going to actually play a huge role in ultimately deciding what kind of productivity happens and how we are able to deliver to clients. So this is really a big one from that work from home perspective. The other perspective from work from home is the focus on diverse segments. So just to share with you a small story, at TCS, um, we have a very good, the department which manages our diversity, and they were talking to various people, and there's a high level of, sort of awareness around diversity, and even people who are, have their own challenges know that there is support available if they ask for it. So during this time, there's a lot of work that we're doing around looking out for people. For example, which kind of segments could these be? It could be women, it could be mothers, it could be single people, it could be people who are physically challenged, who cannot go out of their homes to even get groceries, people with chronic diseases. So how do we support all these people? We need to have programs around each one of these so that no segment gets left behind in each way. And that is part of empathetic leadership. That's part of the normal way of working, to make sure that we are taking all these people with us as we move forward. Next, I want to talk to you about, these are all things that we are all doing, but mental health now is, is the big one, which we all know. Every leader is talking about it, whether it is the prime minister of countries, or whether it is, just before our chairman, Chandra put out a message about mental health as well, that the counselors standing by, or whether it is internally, we're talking about these things. When I'm talking to other people and friends, about this, talking about how they know and they're aware that they should have these things, but they don't have these things. And it is never too late if these programs in place. So I think a lot of organizations do have things like a EAP service which they have empaneled. And it is great if you've done that, because at this time, having trained counselors on call will be able to reach out. But what we've seen is that that is not enough. And what we need is to make sure that our program at TCS is a whole rounded program. It's called TCS Cares, and it is built on the 4 pillars of awareness, creating awareness about mental health, creating understanding, so that we understand not only our own mental health, but the problems that others could be going through, acceptance and being open and being able to talk about our own mental health, sharing in forums, creating safe spaces for people to come forward and to talk. These are all big parts of acceptance. And finally, the support, which could be EAP services, which could be webinars, which could be other self-help resources. So if you're able to create an entire program around it like this, then it's a really well-rounded program, and your people will certainly benefit from it. At TCS, this is a program which put in place this well. We had a EAP service for many years. We were one of the front runners in that anyways. But about almost 2 years ago, is well-rounded program, and we're seeing the benefits of that right now, especially during this this huge crisis time. Part of this, as I was saying, that what are the kind of things that we create as support, and some of the things which we need to do is fall into 3 buckets. One is the aspect of self-help, because everything does not require a counseling service. So if we empower people, if we give them enough materials, if we give them, for example, a webinar like this, right? It is if you log into it, you are helping yourself. That's a self-help resource. Or if you're sharing blogs or some kind of assessments, or any of those things, these are all self-help resources. And the more interesting you make them, people will be able to pick them up and be able to help themselves. So that is something that we do a lot. Second is creating community. So at TCS, we have a concept where we say that everybody, be walking on a tight road, and from time to time we will all fall, and we need a safety net to catch us. And who is our safety net is what is very, very important. And from that perspective, creating community around each other, whether it is for sections, as we were just talking, whether it is women talking to each other about the pains that they're going through there. I think these days, all of us joke about it, of course, that, I think we value our helpers who come to do or our washing or our cooking way more than we value our husbands, right? So these are things which, we share with each other. Or men coming forward to say that, they feel very inadequate because, they've never done these things before, and they feel great fears about, seeing this, and also feel trapped in their environments and different with those things. Or single people coming out to say that, how do we network with each other so that, earlier they could go out, every weekend they could be out, socializing. Now they can't do that, and the only way they can do it is over a call. So how do we create communities that support each other? It's again a big one, and that is a great way to also support and create a program for your people. And of course, the EAP support is something which is really, really important as well. So, so that is the time we are living in, guys. And, it is volatile, it is uncertain, very complex, very ambiguous. And all the things that we have just spoken about, if we are able to do all these things for our people, then the likelihood is that we will have VUCA 2.0, if you've read about it, which is, of course, the positive version of it, right? Which is to have vision and understanding and compassion and agility. And this can be true for ourselves as individuals, as families, as communities, as organizations, as countries, as the world. It can go as far as we would like it to go. And so that is really what I thought, in a quick snapshot, as Ashwini had told me, giving me time, that is what I thought I'd share with you. Just quickly, I've recently launched a awareness and support initiative of my own, which is a pro bono initiative. It's very young yet, it is still sort of taking off, and this is one of the things that I do, which is I share small nudges online, and I thought this one was appropriate for this call, which is that a good life is a process and not a state of being. It's a direction and it's not a destination. So I think we are all moving in a direction which we either know or we don't know. And there's not going to be any destination to this. It's just going to be a nice journey. How good, how exciting it is something that is up to all of us. So thank you very much. And I'm available. I'm open to questions. Please. Ashwini, is that all right?
Yes, thank you, Sangeeta. It was really wonderful, and thank you for sharing the wonderful insights. I hope this session was good for everybody and has given everyone a ray of hope. I love the vision, understanding, compassion, and agility, the new VUCA version. And really, if the session is now open for questions, uh, anybody can, please feel free to ask your questions.
Ma'am, could you please stop sharing your screen so that everybody is visible?
Oh, share my screen? Okay.
At the top, there must be an icon which says stop share.
Stop share. Okay, this is saying new share, so I should stop this, right? Okay, hold on. Oh, yeah, here it is. Great. Thank you for that tip.
Welcome.
All right.
Questions?
You learned something today.
So are these questions going to be on, everybody's mute? You can ask in the chat, or you can also ask me, open your line and ask.
So we request you all to unmute yourself and speak if you have any questions or suggestions or.
Hi, this is Krupa here. Can
Yes.
you hear? Yeah. Firstly, I think you came one bit late. I think you should have been when that lockdown started, much before that, or even at that time, you should have opened up. Possibly, it would have fed in not 2 beds, 3 beds, much more to the population as well as to the houses and other things like that to pick up threads and then make a good living in times of stress and things like that. Yeah, thanks for that. My sorry, my question is, how do we make it happen inside a corporate? It's a bit challenging, right? It's not all that easy as we say. I think we can talk, we can say, but then it's very tough. So, is there anything novel or anything different? Because even with the food material or anything for that matter, nutrition and things like that, when you start talking about it, maybe a few percentile of the people are going for it, but most of them want to stay normal, the median, just stay there, stick there, and then maybe eat less, work more, or make yourself hungry again and then go back and eat and all that thing like that. That was one of the questions. The second question is, see, like medically or clinically, you say that every 2 hours possibly you can, and your system is able to digest, and then you are ready to eat and things like that. And so is the case with the diabetic patients also, something like that. So, is there anything like what we can advise or suggest, like how we can systemize your thing, your food or your nutrition per se, something like that as a common thing. We can send it out as a mailers and make people aware, and then come out and ask for it, and then we provide them. That will become much more two-way.
So, what you said, Binkamanda, is that, you're absolutely right that, a lot of people that we hope to reach out. So, when we are putting together any well-being activities, and these are things that we experience on, even when we are working in, the before COVID. I think nowadays there's before COVID and after COVID, right? So the before COVID times, it is the same that no matter how many activities that you put in, there will always be a certain percentage of people who will be very active. There will be some people who will be, from time to time, they will come in and go out and come in and go out. There'll be some who are totally indifferent, and there are some who will just refuse to absolutely believe that I don't want means I don't want to do this. I think that doesn't change, right? In a few weeks, suddenly people don't become new creatures, right? It's only COVID is the new creature. All of us are pretty much the same. So, from that perspective, I think, but what I do observe, at least at TCS, is that we are finding that there is a much higher uptake of activities. And so whatever we are putting out for them, the number of people who are now actually asking for and joining has really increased. One of the key things I think is to create activities in an interesting way. So, whether it is webinars like this, whether it is interactive discussions, whether it is blogs which invite people to share, so different mediums that are used, and also different interesting topics. Like, for instance, I can give you a example that just last week we did a webinar where we had a very eminent speaker come and talk. And basically we invited not just the TCSers, but we also invited their families to attend the session. So that was something quite new for them, and they really, they were, so even in the invitation mailer, we sent out the mailer saying inviting TCSers and their families. And that got, huge response. So I think the key is that, whatever you do, interesting mediums, and even online, what are the mediums that, frankly, between you and me, I'm also, we are all learning very fast how to use these different mediums, right? Even Zoom, we are not, using, we haven't used that much. So how do we use different mediums to make them interesting? My best bet is I talk to my younger colleagues, and they come up with all the different mechanisms to use, and then we are able to do that. So that is one. Second, around your question around, how do we create, specialized, say, packages for special interest people? And that's exactly what I was saying, that what we have done is that for each and every area of whatever we see as people with specific needs, we have started talking to experts in those areas and creating material around that and doing sessions for them, sharing mailers, sharing tips. And we also have a helpline where people can call and ask for information. So if people call and ask for information, that information is provided. If the information is not available, those topics are collected. And when we see that, there is a specific topic which is getting a lot of interest, we immediately start looking for people who can help us. Because obviously, we are not necessarily, like for example, in nutrition, I'm not a trained nutritionist, and I might be able to say that it's good to eat bhakri, but, other than that, I might not be able to say anything more. And so, we do talk to nutritionists, we talk to doctors, we talk to various people, and the communities, all of them, are being so responsive and willing to come out and help a lot. So definitely, that is something which is helping. I hope that answers your question.
Thank you.
Okay.
Let others talk, I think.
Sure.
Hi, this is Amit here from SEDEX. So I have one question. So depending on how long does the lockdown last and how long we are supposed to stay away from the workplace, how would you see the impact of being away and working remotely in terms of human collaboration, right? What we've been proudly talking about our workplaces for and been designing and developing those. So how do you see that impact depending on how long does it last?
Right. So Amit, I think we are, I think what we are seeing right now, it might be a full lockdown, but by the time we will actually come back to a fully, normal in the sense of how we worked earlier situation, it might be more than, a couple of months at least, is what, my personal thought is. It has taken us, I'm sure it is the same for many people, it has taken us so much effort in the first few days to even help people to start working from home. Whether it was enabling our secure systems, whether it was, some people have laptops, some people don't have, moving desktops to people's homes, people who moved and gone home, bringing them back. So I think that it is going to take some time before people go back, to the way they were working. So I would think it's a good time to actually put in some good practices and even see for the later, time, whether this is a good way of working. There are great models around the world which talk about, allowing staggered working, right? So is it possible to do, it's a good time for organizations to start thinking about these models for the future as well. So that when we do come back to normal, how environmentally friendly are we? How much are we willing to, take into cognizance? For example, things like, when women go on maternity, this is a good testing time, right? That, women can work from home just like anybody else can work, because it's not necessary to be in office to work. So some of the practices that we will put in an organizations right now will probably stand us in good stead in the coming times, in terms of devising new ways of working, is my personal opinion. I don't know if that answers your question.
Just an add-on question more to it, because I've been talking to and participating into some industry webinars like this, and more from the practitioner side, who are real estate people, corporate real estate guys and facilities guys.
Right.
And somehow they are looking at starting the facility again, but they're not thinking about how to address the psyche of the employee and how to get them back, how to instill that confidence. So what do you think would be the right approach to make sure those aspects?
I think, just like anything, a knee-jerk reaction will not be a good idea. I think everything will have to be done slowly. You start to bring people in slowly. You start to develop that confidence. Also see the environment, what the government will say. So, it is all okay to plan in isolation, but I don't think that is how it will work. And there will continue to be issues of basic logistics of, transport or any of these things. And people might not be, it will not be that easy to just bring them back to work so easily. So it will be a phased, slow approach, and it will only happen like that. I don't think it will be something that will happen overnight. So I think that's how it will be.
Thank you.
Dr. Vikram, yeah, please go ahead, Dr. Vikram.
I would like to add few things in the larger interest of the participants here. I am Dr. Vikram Cheriala, practicing physician in Hyderabad. I've been as a assessor in Arogya Health. So I belongs to Family Physicians Association of Family Physicians India. I started as a free campaigning. So this is through a small. I will share the link to the concerned persons. So this is the one website wherein anyone can ask question to qualified doctors. Around 50 doctors are there who are clarifying authentic information on corona. So we have got so many queries regarding just what to touch, cardboard, how long the corona will stay, and all real authentic published papers only we are verifying, and we are filtering the data, and we are posting to the persons. And this is a clear cut voluntary work. Like the website link is www.vfightcorona, wefightcorona.in. Through that, 7 a.m. to 12 midnight, anyone can ask questions through a personal chat to a doctor. So this, as an individual platform, many people can use them as a personal question they will be having. And there are a lot of examples wherein one person stuck in Nagpur and other person unfortunately stuck in another city in India. So they have some logistic problems. The emotional outbreak is too much, and how to maintain it? Like who are the immediate person to contact? So these are also has been brought up in our discussion group, and we have taken it forward through a proper medium. So
thank you so much, doctor. Thank you. And really the work that medical practitioners are doing in this time is invaluable, sir. So I absolutely salute you for the work that you're doing. Fantastic.
yeah, madam, we would like to extend the support with the help of. I will be in contact with Arogya World persons also, and we will. Usha Chandran ma'am is there, so we will be in direct contact, and we will share the links appropriately.
Thank
So
you.
if I can share the links here, I can do it, but I will try to do that from my.
Okay. Ashwini will respond.
Yeah.
Yeah.
So we have a lot of questions here actually, but in the interest of time, is it okay if we send those questions, if the questions are sent to you, and will you be happy to take those questions, Sangeeta?
Can I take just a couple right now? If everybody has the time, I can do that. So there is one which says, Sangeeta ma'am would like realistic situation if you would have faced with respect to how it was handled. Aditi, I'm not sure in what context. If you can elaborate, I can answer the question. Where is Aditi? Okay. And another question is, I have a question. I'm from bank. Now, how do we motivate bank employees? On one side, fear and scare is there. Other side, service of country and population. How to motivate bank employees who are working? I think, this is, Vihal, you have asked me this, and this is a very good question because, anybody who's working in, essential services, as we say, essential services, are people who are at the front line and are definitely going to be going through issues like this. You know what Dr. Vikram just said, whether it's medical professionals, whether it is people who are manning our public transport right now, whether it is bank officials. So there are many people who are part of this, and they certainly they would be scared about what is going to happen to them. One is, I think it is very important to create very strong protocols of how people enter the bank and who are the people, how do they interact with people. Do you create systems where people stand at a certain distance while talking? So those basic things, if we first put in place, that creates, first comfort is around your own physical health issues, which can then to get allayed to some extent. I will not say it gets allayed completely, but to some extent it does. It will help to get that allayed. Second is to also use this time in the bank, because even if bank people are coming, the number of people who will actually come to the bank will probably be very few. So there will also be a sense of ennui or boredom that we are sitting here and what is going on with us. So to create some engagement activities which the people can do over there itself will be a very good thing to do, so that people are engaged. Some fun things for people to do. For example, do a coffee break with each other. Everybody bring some, tie up with each other to say today we will do antakshari around this particular topic, or we will food of this top subject. We can't, eat with each other, share with each other, but we can sit around and do that. Another thing which we are doing at TCS for our people is enabling learning at this time. So if you go on to many of the learning platforms, whether it is things like Udemy or Coursera or LinkedIn Learning, some of the courses on that are just fantastic. So you could also explore those and suggest to your people some really great learning resources which they can use. Courses are anything from 20 minutes, half an hour, 40 minutes, 1 hour, 2 hours to many modules. So you can allow people to actually take up more courses, and maybe you can also say that if you are doing these courses, this adds to certain points that from your particular professional learning and things like that, which will help them. So these are just some thoughts which I have. But I think before anything else, the most primary thing is that are they, there should be no issue around their social distancing, and that must be clearly laid out in the bank. And if that is done, only then can you address the rest of the paper. Does that help you, Bihal? Okay. Okay. All right. I work in a startup when lockdown ends. Okay. So there is somebody who's asking, hello, ma'am, I work in a startup. When lockdown ends, what are the steps needed to be taken one step at a time? Can they suggest HR not to rush employees from day one and give time to puzzle? Absolutely. That's what we were just talking about a little while ago, right? That it will have to be taken step by step. If you try to do everything on day one, it's going to be a complete disaster, and it will not work for anybody. So definitely, I'm sure that your HR also might be having those discussions and allowing for people to take things step by step. Okay. Okay. Shiana's asking any employee engagement that we can do with our employees or factory workers. Shiana, so as we're saying, different kinds of we have different kinds of working environments, and I'm used to working in a corporate environment, but I'm sure from a factory environment, if people are already working there, firstly, I hope that social distancing norms are being followed. And in terms of engagement, I think very simple ones like doing a chopal or having the evening time where everybody sits down, in a circle, enough distance from each other, and plays some small games, or inviting their families once in a while, come one by one and participate in some activities like that, so that the people are not worried that that people are going to work and what is the situation going to be. Just some of the things that I can suggest, but since I don't work in a factory environment, I might not be able to right away think of things which could help you a lot. But having said that, I think whether it is people who work in a factory environment, or it is a corporate employee, or someone who works in a startup or a bank or anywhere, I think one of the big things which we need to do is to create space for people to share and not feel that they need to either put up a very good front or hide their fears. So this, if we are able to do to a large extent, this actually will become a time when people form invaluable bonds with our employees, if we are able to do it right. So this is something which I think I will leave with everybody. Ma'am, our organization. Last question I will take. Is that okay, Ashwini?
Yes, that's fine. Yeah.
Okay. So Emmy says our organization runs a helpline for migrant workers. One of the major issues we face is most of them are anxious, want to go home. What are some of the things that we can do to keep them engaged and happy without anyone being there physically to facilitate anything? Emmy, firstly, hats off to you. If this is the work you're doing, it's very, very amazing work, and really kudos to you and your team for doing this, because this is the migrant workers right now, probably the most vulnerable group in the country, because they are neither here nor there. Some of them are not even able to go home, and so definitely they would be frustrated. Ashwini, Emmy, I'm not sure right now whether we can engage them in anything other than trying to get them the basic resources that they need. And that is what will help to take their frustrations away. One thing I can suggest is that I don't know if it is possible, but like I'll share this from my personal experience. My the lady who works for me, who lives in my house, she has a phone, but her phone doesn't have a video facility. And what we do now is that we asked her to talk to her family in Nasik, and we told her that you tell them to send us a number of a person who has a phone with video facility. And from time to time, what we're doing is that we are giving her our phone and over there, and she's being able to talk to them via video calls, and that is really keeping her feeling very happy. So this is one thing which I don't know how you will facilitate, but you could suggest, and this is something that you could possibly put in place for them. I don't know if that will. Okay.
I'm sure there will be a lot of other questions that people will have, but we can share if that's okay, and if they can reach out to you, if there's a where people can reach out to you, if there's a link or anywhere where they can reach out to you, it will be great if you can share. But with yeah, okay.
Certainly, Ashwini, certainly.
I really want to take this opportunity to thank everybody for attending, for coming, attending this webinar, because I know now everything is virtual and people are so busy with calls and meetings, which are, which is all work from home, the new norm. I don't know how it's going to be, but yeah, certainly for now. But then, all the people from infra, CII, GACS, so many other industries who have actually, joined this. And this is our effort, our effort is to provide a common platform to everybody where we will have this sharing of, best practices, sharing your initiatives, so that we can learn from each other. And everything may not work for everybody, but even if there are a few things that work, it is going to help us and help the organizations overall. So I really want to thank also the Arogya team, the entire Arogya team, for getting this together. Thank you all very much. Please share some of your best practices. I'm requesting everybody who's there on the call to share some of your best practices with us. We will be collating all these, we'll have a couple of other webinars coming up, and we will be collating all these best practices and creating a report, so that, it just helps everybody to, understand what others are doing during these times, because none of us were prepared, and then, all of us had to do what we have to do. So I think, Sangeeta, one day at a time is what I, hear, that what you're saying, one day at a time. And just, we have to be strong. We are all in it together, and this phase shall pass too. So
Well
thank
said.
you. Yeah.
Well said. Thank you. Thank you very much.
Thank you,
everyone for attending. Thank you very much.
Just before we end the call, one last thing, that we will have our second webinar on Tuesday, April 14th, and we will be talking about, again, engaging and energizing employees during COVID-19. Thank you.
Thank you.
Thank you.